Welcome to Prescribing Lifestyle, the podcast that's all about empowering you to live your healthiest, happiest life. I'm your host, Dr. Avi Charlton, and each week we'll dive into the latest research, practical tips, and inspiring stories to help you optimize your well-being. From nutrition and fitness to mental health and mindfulness, we'll explore every aspect of lifestyle medicine, giving you the tools you need to make informed decisions and take control of your health. Whether you're looking into preventing disease, managing chronic conditions, or simply elevate your quality of life, Prescribing Lifestyle is here to guide you on your journey to wellness. So, sit back, relax, and get ready to embark on this transformative adventure towards a healthier, happier you. Let's dive in. Hello, listeners. Welcome to another episode of Prescribing Lifestyle Podcast. Today, I have Dr. Lucy Burns. Dr. Lucy, I've known her for about 5 years. I listened to her talk at Low Carb Down Under Doctors Conference in 2019. She didn't know me then, but I was amazed and inspired by her journey, and I was inspired to become a low-carb GP. And since then, I've followed her journey, and she's the founder of Real Life Medicine with Dr. Mary Barston. And I've been following her podcast as well, on and off. And I'm so delighted to learn a lot from her about low carb and weight loss and all these things in the lifestyle space. And I'm so delighted to be with her next Monday for the Australian Weight Loss Summit, which is starting this Thursday, but we're both speakers next Monday coming up. So welcome to the podcast, Lucy.
Oh, thanks, Avi. Thank you so much for having me. I'm honoured to be your guest.
Thank you. I am really intrigued about your specialty on menopause, so I'm hoping to talk about menopause today.
Yeah, absolutely. So it came about basically because a lot of the women that we were helping are in that either peri or post-menopause space. And for lots of them, that was the time where they gained weight or their metabolic health declined. So they started developing fatty liver and pre-diabetes in that sort of 40s, 50s age range and then beyond. So I thought I've got to learn about this. What's going on?
Yeah. So can you just tell us what the difference between perimenopause and menopause and post-menopause is?
Absolutely. So menopause itself is like one day. It's like your birthday. It is the day, technically, that is 12 months from your last period. So you have up every day before that is called perimenopause, and every day after that is postmenopause. The interesting thing is that perimenopause is generally considered the sort of time of mayhem where your hormones are all over the place. But honestly, you can still have symptoms of menopause even in that postmenopause period. So the perimenopause can last for up to 10 years. So many women will start experience perimenopause symptoms in their early 40s.
Yeah. So I have lots of patients that come in with lots of troubling symptoms. It's a really common complaint. They have hot flushes and brain fog and all these sorts of things. What do you see as the common symptoms and challenges that women face?
Yeah, so I mean, everybody knows about hot flushes and night sweats. I think that would be the hallmark with women fanning themselves, but they're probably the tip of the iceberg. And a lot of women going through perimenopause don't actually have those symptoms. So they're called vasomotor symptoms, but we also have a lot of brain symptoms. So there are lots of estrogen receptors in our brain. And they're great. Like estrogen is a wonderful, wonderful hormone, and it protects our brain in many ways. It's very anti-inflammatory. It's neuroprotective against things like Alzheimer's disease, and it facilitates a lot of our brain energy. And so when we have fluctuating hormone levels, we will often get symptoms like brain fog, as you mentioned, the temperature regulation, which also occurs in our brain, and even things like anxiety and, symptoms that would normally be the domain of mental health are actually often menopause symptoms. They're not necessarily treated as such, but that's probably changing a bit.
Yeah.
And then on top of that, we've sort of got physical. So we've got sort of the brain things, and we've got the body things as well. So the body things is that there's estrogen receptors, again, all through our musculoskeletal system. It's really important in muscle development. It's really important in collagen and skin and tendons. So part of the reason why women we'll notice a big change in their skin quality after menopause is because estrogen disappears. And so your collagen and elastin changes. And so you end up with that sort of more wrinkly skin. And estrogen is also really important in subcutaneous fat, which I know as women we don't love. Nobody loves the fat that's on your hips. But that's the fat that is pretty safe for us as humans. And it does disappear after menopause, which is why people will often notice a decrease in the fat, even in their face. So they'll get that sort of more drawn look. So we've got those sort of things happening in the musculoskeletal system. But then, as you and I are very interested in, it's the metabolic side of things where estrogen really has, it's a game, it's a major game player. So when estrogen it protects us against insulin resistance, it increases our metabolic rate. So our metabolic rate, for your lovely listeners, I like to describe it as it's the amount of calories that you need just to run your body when you're lying around doing nothing. So the amount of energy required to beat your heart, to grow your fingernails, to replace your eyelashes, to digest your food, that's all just your basal metabolic rate. And then we have more energy expenditure doing other things like movement or exercise or stress or whatever those things are. So estrogen's a major player in that. And so what we find is that when women go through menopause, they have what we like to call the metabolic triad. So with the metabolic triad, you reduce your estrogen, and that causes your insulin to increase. And interestingly, also causes your cortisol to increase. And we know that when your cortisol increases, your insulin increases. And estrogen and cortisol have a bidirectional relationship, which means when cortisol goes down, when estrogen goes down, cortisol will go up. Vice versa, when cortisol goes up, our estrogen production from the adrenal glands will go down. So it's yes. So yes, it is a bit of
put on weight.
Yeah. That's why women will develop, start putting weight on or developing fat stores in their middle and around their organs, which is exactly the fat we don't want to have.
Yeah. So that's annoying that we just put on weight in the wrong bits.
Yeah, and you will not change your diet at all. You can have exactly the same food, and this will just start to happen for lots of women, which doesn't mean it has to happen, but it won't. It will happen if you don't change something.
I was
going to say, if you carry on doing what you're doing, you will end up with increased belly fat. And so I guess the way I like to look at management of menopause is the 4 S's.
Okay.
So the 4 S's are our sustenance, which is our nutrition. I just needed an S word. So sustenance, strength training, sleep, and stress management.
Okay.
And the reason that we focus on those 4 S's is because they are the biggest players in your metabolic triad.
Okay.
So we know for sustenance that eating a whole food, low carbohydrate diet will reduce your insulin, which is great. That's what we want to do. We want to reduce insulin. When we reduce our insulin, then we have access to our energy stores or our fat stores. That helps our body run more effectively and helps our brain run. So brain fog can be countered by reducing insulin and having access to, the alternate fuels that I'm sure your listeners are aware of both glucose and ketone bodies.
Mm. Do people have to be keto or low carb is okay?
Yeah, I think low carb is fine. Again, we have a little saying at Real Life Medicine that one size fits some
Mm.
of the time.
Yep.
So there is no one size fits all. And so for some people, they will want to do a ketogenic diet because there's extra benefits that they might be helpful to them. It might be really helpful for their brain fog. Maybe they try low carb and they've still got brain fog, so they'll go keto to improve that.
Mhm.
Or maybe they've got lipedema and they're looking to improve that, and there's evidence that a ketogenic diet will improve lipedema.
Mm.
Or maybe they've got chronic back pain and there's evidence that a ketogenic diet will improve pain there. But you don't have to do the full-blown ketogenic diet if you don't want to. Low carb is often enough for most people.
Yeah, sure. All right, great, great. So that's sustenance.
Yeah.
And
And strength, which I know you're all over. We know that muscle is our metabolic organ. And, at its very heart, the bigger your muscles, the more glucose you can store in them. So, if people are wanting to, if you want to store, if you've got nowhere to store glucose, then it will get turned into fat. So if you've only got a very small reservoir, a small, muscle mass, then any extra carbs that you eat will get stored put into your fat stores. So we want muscle to be as big as possible so that you've got more place to store your glucose. But we also know that the bigger your muscle mass, the higher your metabolic rate, which is, of course, the amount of calories that you burn lying around doing nothing, which is awesome. Like I kind of go, yeah, who doesn't want to do that? Like let's just lie around and burn calories for free.
yes.
So strength training is super important for that. And it also, because with decreasing estrogen is and interestingly in menopause, we also decrease some testosterone. For women over 40, every year over 40, unless you make active steps to change it, you will be losing muscle mass.
Yeah.
So we have to do something to counter nature.
Yeah. So those people who are going for walks, are they building muscles?
No.
I don't think, no.
No, walking's great. Don't get me wrong.
Yeah.
I think walking is
Yeah.
great. It's got lots of benefits. It's good for cardiovascular health. It
Yeah.
will use up some glucose, particularly if you walk after a meal, but it doesn't build up your muscle. Unfortunately, you need resistance training or you need to do something that is against a load. So it doesn't mean lifting dumbbells or, doing the snatch and grab or whatever it's called.
Yeah.
But doing things like practicing getting up out of a chair without using your arms and then repeating that 10 times. That will build. That's my number one favorite exercise for people because your glutes are your biggest muscle base, and quads. So let's build on those ones.
Yeah, I also say you don't have to do a lot, like 15 minutes twice a week. That's pretty good already.
Yeah, absolutely. Absolutely. And so again, I think it depends a little bit on this. There's going to be genetics involved. We know that we've got some people who seemingly, lift one finger and build muscle, which is great for them, but lots of other people need to just work that a little bit harder. And that's just it. Like there's genetics that you can't change. You can't change necessarily the cards you're dealt, but you can change the way you play them.
Yeah, that's great. Yeah, I think everybody should be strength training, lifting a little bit of weight, doing some squats and a little bit of push-ups. So I think that'll be great for everybody to be prescribed some exercise program.
Yeah, absolutely. And basically we're training for life here. Like you're training so that, when you're 75 years old, you can still lift your shopping in and out of the boot easily. Or, if you're 69 years old, that you can get up off the floor having played with your grandchildren. Or, you can take the dog for a walk and the dog's not going to pull you over if it just does a little tug. So there's so many things that you're training for. But as far as your metabolic health goes, we definitely want to build as much muscle as we can.
That's great. And the third S is sleep.
Yeah. Yeah. And again, the benefits of sleep are vastly underestimated.
Mm.
And I often say to people, imagine if I opened a clinic or
Mhm.
a day spa and I said to you, all you have to do is lie around. And in that time, we're going to improve all your hormones. They're going to work so much better. We're going to improve your memory that you'll be able to learn faster. We're going to have it so that we can repair any broken DNA will just get repaired with like magic. And your proteins, any damaged proteins will get repaired and your inflammation levels will just plummet. And we do all of this and you don't have to do anything. And people would be lining up. Like if I could bottle that, they'll be lining up.
Yeah.
And they're just some of the benefits of sleep.
Hmm.
And all people have to do is go to bed.
Yep. Yep.
So one of the things that I love saying is that humans are we're the only mammals to voluntarily restrict our sleep.
Mm.
We're like the stupid ones, watching telly till 1 o'clock in the morning or scrolling on our phone or, just not going to bed. You don't see dogs doing that. They just go to sleep.
Yeah.
Horses aren't watching Netflix. They're just sleeping. We're the sort of stupid ones who don't just go to bed. Now, I get why we don't. I get it. I get that particularly for women, we're often, it's like at my time,
That's
the
it.
day,
The
jobs
kids
are
are
all
gone to
done.
bed. They just want to
Yeah.
relax and scroll on the phone and watch
Yeah.
Netflix.
Yeah. And then, the minute you go to bed, it all starts again.
Mm.
But actually delaying going to bed, it really just sets you up every single day to start behind the eight ball. You're constantly playing catch up and you're not getting the benefits of, again, imagine just being able to reduce inflammation just by going to bed.
Yeah, I must admit, now that I know all the benefits, I'm quite religious going to bed at the same time every
Yeah.
night.
Well, I was most definitely a person that doesn't go to bed. And even now, it's my default. If I'm stressed, I will suddenly, it's like a barometer now for me. If I find myself still up at 11:30 on watching telly, I think, oh, what's going on? And
Okay.
there's often some stress or something on there.
Yep.
So a little hack that I have is I call my bed my rejuvenation palace.
Mm,
And
like that.
I take some things that make going to bed a little bit more fun.
Okay.
So, which is really a cup of tea in a fancy cup and a book. And I
Okay.
just sit up in bed, like, with my fancy tea and my lovely book. And I read, and I don't read any medical books or business books or anything in the evenings. It's my, sort of just pleasure reading.
Yep.
And so at the moment I'm reading Bridgerton. And so I'm
Okay.
excited to go and hop into bed and find out what's happening in Bridgerton.
Oh, good. I have a gratitude journal and I only have 3 points in the gratitude journal. So it takes less than a minute to think of 3 points to write in my gratitude journal. But I look forward to that and I think positive things that's happened in my day, and that's my little new habit that I've accumulated. That's been good.
Yeah, well, that is an excellent habit. And I think that probably leads into the fourth S being stress management,
Yeah. Yeah.
because you're right. There's absolute tons of evidence that
Mm.
reflecting and looking for positives throughout your day is something that is going to help you
Mm.
manage your stress.
Yeah, now everybody's stressed because we're so busy. We've got so many things to do, running around, drop off, pickups.
Yeah.
And I think we actively have to manage it and look after ourselves to reduce the stress.
Oh, 100%. And I think what's happening for a lot of people is they think that the way to manage their stress, like they don't have any techniques. They just
Mm.
think that they need to get rid of external stressors. So the things that are causing them stress. And of course, sometimes that's like your children or your
Mm.
husband, and your brain goes, well, I can't get rid of them, so I'm stuck.
Mhm.
And so all they do then is spend their life wishing that they could run away to a deserted island. And
Mm.
that's their only way then they think that they could manage it. But that's not actually true. what we want to do is, yes, if there's things in your life that you can get rid of that are causing you stress, and that might be things like, toxic friendships, for example,
Mm,
then yeah, by all means do that. But you can actually just learn to, master your inner self to some
mhm.
degree, which gives you that resilience to be able to sort of weather the stressful storms rather than just wishing they weren't there.
Yeah, absolutely. Yeah. I talk about meditation and breath work and going for walks and practicing mindfulness. I think doing all those things can improve our resilience. And when the stressor comes, when there's things that happen to our life, which it will happen, then
Mm.
then we've got more tools to harness and be stronger and more resilient to our stress.
Oh, totally. And I think, people will often go, oh, life threw me a curveball. But I actually just think life is a curveball.
Yep,
It's
yep,
just one giant curveball, and we have to therefore be learning and practicing. It's all very well to know them, but if you don't practice them, practice these meditation or breathwork strategies. And in fact, Avi, you'll laugh at this. I've been thinking of you a lot because
all right.
I go swimming
Yeah,
and I do backstroke.
yeah.
And I like that when it's sunny and warm enough, I swim outside. So it's, I get that benefit of sunlight. But at the moment I'm swimming indoors and I'm practicing my breath work
Oh,
while I'm doing it.
great.
So
Oh,
I've been
great.
breathing in my nose and out my mouth. And every time I just think Avi would be so proud of me.
That's great. And if you can breath hold longer and longer, then you'll improve your carbon dioxide tolerance, and then that'll have lots of good effects as well.
Yeah. Yeah. So I think that things like, and exercise itself is a brilliant stress management tool, outside of metabolic health or functional health, it's a really good thing for mental health.
Yeah.
And again, I think, and I'm there and I'm, you know, I was about to say motoring up and down. That's probably a bit of an exaggeration. More sort of like crawling up and down on my, and all I keep thinking of is my myokines that I'm
Yeah.
releasing with every contraction of my muscle. It's helping my mental health. It will help me feel better. If I feel better, then I can manage stress. I'm not so reactive. I'm not so irritable. I'm not so snitchy.
Yeah.
And that's got to be good for not just me, but for every single person around me.
Yeah, absolutely. That's great. So that's all very well, the four S's:
Mm.
sustenance, strength, sleep, and stress. So
Yep.
that's all lifestyle things. So we can all think about these lifestyle things first. But then there's these patients that do all that. They say, "Oh, I do all that, and I'm still not
Yeah.
coping with all my symptoms." What do you think about medications?
Yeah, absolutely. So there's the fifth sort of arm of all of this is menopause hormonal therapy, which used to be called HRT or hormone
Mm,
replacement therapy. It still is called HRT for women that have had premature menopause or premature surgical menopause. They absolutely need their hormones replaced to, an appropriate physiological age. But what we're finding is that some women still need menopause hormonal therapy.
mm,
And I think that in lots of parts of the space that you and I work in,
mm.
there are plenty of people who are very anti any medications.
Yes. Yep.
And so, it's all lifestyle, 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 lifestyle.
Yep.
But honestly, that's really unfair because
Yeah.
there are people who do need hormone replacement therapy to manage their symptoms. And in particular, once their symptoms are managed, they can then implement their lifestyle. So
Yep.
for lots of people, they need a bit of both, and that's okay.
Mm. I'm I don't think we've been taught very well about HRT or MHT when I was in medical school, because the Women's Health Initiative just came out. And I'm just starting to learn more and more in the last few years about how to prescribe MHT, and lots of women have great results.
Yeah, and look, I think there's still a lot of fear around it with the risk
Mm,
of breast cancer.
mhm.
And uh, I mean, lots of people know, but lots of people don't know now that a lot of the results from that Women's Health Initiative have been, redacted. And the interesting thing is that they were done particularly on very old style medications. So we used to use a lot of, so Premarin was the major estrogen, which is made from, horse urine. It's a synthetic estrogen. We've now got topical estrogens, which are absorbed through the skin, so they bypass the liver. There's no... And look, this is the interesting thing. So, earlier in the podcast, I talked all about the benefits of estrogen. The benefits of estrogen on our cardiovascular health are incredible because when women, if you compare their cardiovascular risk pre-menopause to post-menopause, it dramatically increases because estrogen is so protective. So initially the thing was, well, let's give all the women estrogen. We'll protect their hearts. That'll be great. Problem was that estrogen is pro-thrombogenic, meaning it clots once it has to go through the liver. And so actually not everyone, but there was an increased risk of clotting, clotting-related conditions like stroke, and that's no good. So transdermal estrogen, either through a patch or a gel, carries no increased risk of clotting. And the other misunderstanding out there is that lots of people are scared of estrogen, thinking it's going to increase their risk of breast cancer. But interestingly, there is a very recent study that was released that shows for women who only take estrogen, and the only women that can actually do this are ones who don't have a uterus anymore, they have a decreased risk of breast cancer. So not only does it not cause it, it seems to protect it at some level. So the women who had increased risk of breast cancer, which is why the Women's Health Initiative was so controversial, was the women that were taking the old conjugated equine estrogens and the old synthetic progesterones. So we now have new progesterones that are called body identical progesterone, which is micronized. It's called micronized progesterone. It's a completely different formulation to our traditional progesterones, which are synthetic. And the combination of transdermal estrogen and micronized progesterone does increase the risk of breast cancer very slightly. But it is way less than it was with the synthetic progesterones and the equine estrogens.
Yeah. And I think in the study back in the old study, the women were older and a lot of them were smokers, and there's lots of other factors that increases their risk of cancer as well. Is that right?
Absolutely. And what we want to do is actually, have a think about, well, what are we aiming for here? So the risk of breast cancer in women who have obesity and or insulin resistance type 2 diabetes, so metabolic health dysfunction, their risk is much bigger. So the British Menopause Society has a great infographic, and they look and, they go, right, there's for every 1,000 women, there's going to be 13 that will get breast cancer. If we add the estrogen and progesterone, there will be an extra 4 out of 1,000 that will get breast cancer.
That's not much at all.
If we just look at women with obesity, an extra 24 will get breast cancer.
Okay.
So whilst MHT is not a cure for obesity, what it can do is it can help people manage their symptoms so that they can start implementing their lifestyle measures. That can help reduce the obesity. The obesity, and I know obesity is a trigger word, and for anybody out there who feels triggered by it, I'm just using it in the medical definition. But we know that when our body is storing excess fat, that the fat itself is inflammatory, that the fat itself produces tons of estrogen. and that the underlying mechanism for that excess fat is often high insulin. High insulin is a growth factor, and that increases the risk of breast cancer as well.
Yeah, absolutely. That's a lot of great information. I think the body positivity movement is wonderful in one way, but it's not really healthy in the physical side of things. So we really should think about reducing our weight because of the inflammation and the metabolic health and all the risk of chronic conditions and cancers and all those things.
Yeah, absolutely. And I think that there is no doubt that that storing excess body fat is not great for our health. It's not great for our long-term health. It's not great for our longevity.
Yeah.
What we want to do, and this is the difficult path that you and I walk on, is recognizing that the reason people's bodies are storing excess fat is not their fault.
Yes, sure. Yeah.
So a lot of people will go, yeah, it is my fault, Lucy, because, I ate all the ice cream and I ate all the Snickers and I ate all the shitty food. And it's like, yeah, well, there's a whole heap of reasons why that happened, though.
That's right.
And,
Yeah.
We've got marketing, mayhem, I used to call it mischievous marketing, but it's actually way, way more sinister than that. It's not a bit of mischief. It's absolutely, predatory, purposeful, misleading marketing that they start and they start on kids.
Yeah.
So we've got
the
all
whole,
of those.
Yeah, the whole culture is so obesogenic that we've had treats and it's so hard to get low carb, and then the food industry marketing, it's so hard for everybody to eat
Yeah.
right.
Yeah, it is. And this is where some of the body positivity movement can be damaging, because it's like, well, what if you do want to lose a bit of weight? Are you even allowed to say that out loud anymore? Or are you now just being, vain and diet culture-y? And this is where you've got, I'm always reminded of that great speech from America Ferrara in Barbie about women. You're not allowed to say you want to lose weight. You have to say you want to be healthy. You have to be healthy, but you're not allowed to try too hard. You have to, you have to have, your natural color hair. You're not allowed to dye your hair, but if you go grey, well, then you're letting yourself go. It's like you're stuck in a rock and a hard place. And I just think at the end of the day, what we want to do is we want to be focusing on both our metabolic health and our functional health, because the whole thing is so many people out there work really hard their whole life, working towards retirement, can't wait to retire, live out their glory years.
Yeah.
And they either don't get to live them, or they certainly don't feel glorious in those glory years.
Or maybe when they get there to retirement age, they're sick and not well, and they can't enjoy their retirement. They can't go traveling. They can't enjoy their lives. They're not healthy.
No, instead they're traipsing around to various doctors and physiotherapists and rehabs and having hip replacements and, having stents and all sorts of things that will prolong their life. But it's that health span over lifespan.
Yeah. That's a lot of great information, Lucy. So you and I will be on the Australian Weight Loss Summit next Monday, and you're talking about menopause.
Yeah.
And the participants can get a chance to ask us questions for a panelist Q&A session. That'll be great.
Yes. Yeah, absolutely. And I love answering questions and talking. I love talking about, like you, I talk about, metabolic health, mindset, and menopause. They're my three kind of loves, because I think that mindset's so important, because for lots of people, they do have knowledge. They know what to do, but just doing it.
Yes.
There's some block, and they can't, working through that. Unless you can work through that, you just keep trying. It's like banging your head against a wall.
Yeah, that's it. That's fantastic advice. So tell our speakers where they can find you, Lucy.
So, Real Life Medicine, as you mentioned earlier, is the name of our business that I run with Dr. Mary. And Dr. Mary and I are both lifestyle medicine physicians, again, passionate about metabolic health, mindset, and menopause. And everything is under Real Life Medicine, except our website, which is it's sort of truncated to RL Medicine, because Real Life Medicine's a very long word. So it's rlmedicine.com, and I have I've got a checklist, a perimenopause checklist, because again, the symptoms can feel so vague that people think what's happening is women are going to their doctors and they're saying, I've got a bit of brain fog, and they're getting dismissed. Whereas if you can download this checklist and you tick it all off and you go to your doctor and you go, look, these are all my symptoms. It can be really helpful then for them to go, oh, right, God, that's actually a lot. And you can have a score that then tells you what, whether the symptom you have is likely to be related to perimenopause or whether it's just that, you hurt your knee.
That's great.
So rlmedicine.com/checklist for that.
Fantastic. Oh, thank you very much, Lucy. That's a wealth of information. I love following you on socials and all your Facebook lives that you have for just 2 minutes.
Oh, thank you. Yes, we just do a little mindset one every morning just to keep, again, a bit of motivation for the morning.
That's great. Well, thank you for coming on. Thank you for all our listeners for tuning into Prescribing Lifestyle. Until next time, we'll invite another guest and we'll have lots of discussion on interesting topics about lifestyle and maybe medications as well. Thank you, everybody, for tuning in.
Bye.
Thank you for tuning in to another episode of Prescribing Lifestyle Podcast. Before we wrap up, I have an exciting news to share. I have a new ebook called Low Carb Made Easy. It's now available. This guide is perfect for anyone looking to dive into the low carb lifestyle. Inside, you'll find the basic theory behind low carb eating, a detailed food list, practical meal plan, and a variety of delicious recipes. It's designed to make a journey to better health easier, simpler, and enjoyable. For those who prefer a hard copy, head over to my website and register your interest using the link provided. My website is www.mlcclinic.com.au. Head to online store. Remember, the information shared in this podcast, it's for educational purposes only and not proper medical advice. Always consult your medical professional before making any changes to your lifestyle and diet, or you can come and see me in Melbourne Low Carb Clinic. If you enjoyed this episode, don't forget to subscribe, leave a review, and stay connected with us on social media. Your feedback will help us improve and reach more listeners. Lastly, if you found this episode helpful, please share it with your friends and family. Together, we can make a positive impact to our health and our communities. Thanks again for listening, and as always, stay healthy and happy. Until next time.